Selegiline is an antidepressant that works by balancing natural substances in the brain to improve mood and feelings of well-being. It comes in a patch form that is applied to the skin. Before using the Selegiline patch, be sure to read the information provided by your pharmacist. Follow the instructions on the package for applying and disposing of the patch. Make sure to apply the patch to clean, dry skin on the upper body, upper thigh, or outside of the upper arm. Change the patch daily and use a different area each time to avoid irritation. Be sure to wash your hands after handling the patch and inform your doctor if your condition does not improve or gets worse. Some common side effects of the Selegiline patch include dizziness, drowsiness, redness or irritation at the application site, tiredness, weakness, problem sleeping, constipation, and dry mouth. Remember to get up slowly when rising from a sitting or lying position to reduce the risk of dizziness and lightheadedness. Serious side effects may include fainting, mental/mood changes, muscle stiffness or twitching, changes in sexual ability or interest, shaking, swollen ankles or legs, unusual weight gain or loss, eye pain, vision changes, seizures, high blood pressure, and serotonin syndrome. If you notice any symptoms of a serious allergic reaction, such as rash, itching, swelling, dizziness, or trouble breathing, seek medical help right away. There may be other side effects not listed here, so always contact your doctor or pharmacist if you notice anything unusual. Antidepressant medications are used to treat depression and other mental/mood disorders. They can also help prevent suicidal thoughts and provide other important benefits. However, studies have shown that a small number of people, especially those younger than 25, who take antidepressants may experience worsening depression, other mental/mood symptoms, or suicidal thoughts/attempts. It is important to talk with your doctor about the risks and benefits of antidepressant medication, especially for people younger than 25, even if treatment is not for a mental/mood condition. Tell your doctor right away if you notice worsening depression/other psychiatric conditions, unusual behavior changes, or other mental/mood changes. Be especially watchful for these symptoms when starting a new antidepressant or when the dose is changed. This medication must not be used by children younger than 12 years due to an increased risk of serious side effects, such as extremely high blood pressure. Also, this medication is not recommended for use by children between 12 and 17 years old. Studies have not shown it to work in children in this age group. Before using the Selegiline patch, make sure to tell your doctor or pharmacist if you have any allergies or if you are allergic to any of the ingredients in the patch. Also, inform them about your medical history, especially if you have certain adrenal gland tumors, heart problems, high blood pressure, mental health disorders, liver problems, or nervous system diseases. Be careful when using this patch, as it may make you feel dizzy or drowsy. Avoid alcohol or marijuana, as they can increase these effects. Do not drive or operate machinery until you can do so safely. Also, avoid exposing the patch to direct heat sources, as this can cause more of the drug to be released into your body. If you are going to have an MRI test, let the testing personnel know that you are using the patch, as some patches may contain metals that can cause burns during the test. Before having surgery, inform your doctor or dentist about all the products you are using, as you may need to stop using the patch before the procedure. If you are pregnant or planning to become pregnant, discuss the risks and benefits of using this medication with your doctor. It is also important to talk to your doctor before breastfeeding while using this patch. Narration: keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Selegiline include a long list of medications, street drugs, supplements, and certain foods and beverages. The risk of serotonin syndrome/toxicity increases if you are also taking other drugs that increase serotonin. Tell your doctor or pharmacist if you are using any of these medications before, during, or within 2 weeks after treatment with Selegiline. Also, follow special dietary restrictions to limit the amount of tyramine in your diet if you are using the higher strength patches. Get medical help right away if you notice symptoms of high blood pressure. And make sure lab personnel and all your doctors know you use this drug. If the patch is chewed or swallowed, it can be harmful. If too much is taken, the patch should be removed. For serious symptoms like passing out or difficulty breathing, call 911. Otherwise, contact a poison control center immediately. In the US, call 1-800-222-1222. In Canada, call a provincial poison control center. It's important not to give this medication to anyone else. Your doctor may want to do some tests, like checking your blood pressure, while you're using this patch. Make sure to keep all of your medical and lab appointments and talk to your doctor if you have any questions. If you forget to use the patch at the usual time, you can still use it later on. But if it's almost time for your next dose, it's better to just wait and apply the patch then. Don't try to make up for the missed dose by using 2 patches at once. Store the Selegiline patch at room temperature, away from light and moisture. Only open the foil pouch when you're ready to use the patch and don't store it in the bathroom. Keep all medications away from children and pets. Make sure not to flush the patch down the toilet or pour it into a drain unless instructed. When the patch is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.